Once upon a time, in a land down under, far, far away, there was a castle called Royal North Shore Hospital. They used paper-based referrals for surgery, which was inefficient and meant there was missing information, with lots of time and administrative burden. This led to an ineffective use of resources and a generally unhappy king. They searched and searched until they found Diamonds, a digital pathway for improved assessment, management, and optimization of patients for planned surgery. Our Diamond was a digital platform to streamline preoperative care. How this worked is once the patient was recommended for surgery, patient information was sent to include an extended health questionnaire which provided us with an in-depth medical history. This automatically triggered resources for optimization and calculated risk scores, allowing us to determine whether or not the patient was appropriate for pre-admission clinic prior to surgery. This pilot study aimed to evaluate the impact of the digital platform on clinical outcomes, staff workloads, and patient usability. A two-part analysis was done. Firstly, we conducted a retrospective audit of the platform backend data and hospital data for 6 months. Secondly, we compared those patients who were planned for surgery within 3 months of being recommended before and after implementation of the platform. Of the 3,300 people invited, 90% signed up to the platform. You can see that in the green graph. You can also see the wide age range from 18 to 98 in the blue graph, which completed all the tasks within registration. Preliminary results showed that majority of users found the platform easy to use. By digitizing the space, we've been able to save space by doing more thorough assessments prior to clinic and sending out pathology requests directly to the patients, allowing us to convert our face-to-face appointments to telehealth. This led us to saving time within pre-admission clinic with its duration halved. Lastly, one big thing automation has also allowed us to do is to easily identify populations at risk. Based on patient answers, we are now giving 100% of patients who are identified at risk automated information to optimize their health through the platform. The most developed of these pathways are those who are frail. Thanks to our in-house physio team, we've been able to develop this pathway, so in the time it would previously take to assess 1 patient, we can now assess 24, which are all identified as frail, with those who are identified with high risk getting one-on-one help. So, as the story goes, the digital platform had high uptake and usability. It showed potential to improve workflows. It offered a scalable, efficient model for health systems. It demonstrated potential for digital transformation in preoperative care to help reduce administrative burden. This meant a very happy king. However, further research is needed to evaluate long-term impact and wider applicability.